Here we go. Again, welcome. And if you have questions, ask some questions during the webinar. It is our expectation that the webinar will answer many questions and concerns that you as grantees will have. Additionally, every attempt will be made to answer questions posed by participants at the conclusion of the webinar that are not specific to an individual grantee's application or your grant award. Questions may be typed in at any time during the webinar. Please be reminded that grantees will not have access to make audible comments during the presentation this morning. The agenda for today's call: welcome and introductions. You've been welcomed. We'll have introductions shortly. Overview of ACF and FYSB, Family and Youth Services Bureau. Overview of PREP Innovative Strategies Program Requirements and Grantees. Contractor Support and Resources. For the introduction of federal staff that are participating in today's call, again, I am Labrita White. My title is Program Analyst, but I also serve as Project Officer for the PREP Innovative Strategies Grant Program. Griffin Mulcahy is also a part of today's call. He's a program specialist and a backup when I'm not available to respond to grantee questions and concerns. And also Debbie Powell, who is our Acting Associate Commissioner, and she's also wearing another hat of serving as our division lead, and she's the commissioner for, the Acting Associate Commissioner for the Administration on Children, Youth, and Families, as well as for the Sub-Agency Family and Youth Services Bureau. Congratulations on your awards. And just to share with you the purpose of today's call is to provide you some guidance on your grant, the grant processes and your post-award status. Also to address any questions that you have in regards to moving forward with the phase. And we have a typo here with post-award state plan. That should really read your phase-in implementation period. I apologize for that. As well as to provide resource and contact information. Again, to reiterate the federal staff that are part of the PREP Innovative Strategies program, and an additional person who has not been introduced and will not be participating on today's call, but is very instrumental in the grant process, and that person is Julia Elam. She's your grant specialist. At this time, I'd like to turn the presentation over to Debbie Powell to provide an overview of ACYF and FYSB.
Good morning, grantees. I am working off-site at a national meeting, and I'm using my BlackBerry to communicate and participate with you on this webinar, so I am hoping that my audio is coming across clearly. I know that you probably have had some introduction to the ACYF and FYSB since receiving your grant award a couple of months ago, but just wanted to give you a brief overview for those of you who may not know exactly where the Family and Youth Services Bureau lies within the agency. The Administration on Children, Youth, and Families, ACYF, administers the major federal programs that support social services that promote the positive growth and development of children and youth and their families. Also protective services and shelter for children and youth in at-risk situations, and adoption for children with special needs. And these programs provide financial assistance to states, community-based organizations, and academic institutions to provide services and carry out research and demonstration activities and undertaking training, technical assistance, and information dissemination. And within ACYF, the FYSB, Family and Youth Services Bureau, lies within. And we are responsible within FYSB for additional programs, the Mentoring Children of Prisoners program, the Running Away of Homeless Youth program, the Domestic Violence Prevention Services program, and all of these programs provide national leadership on youth and family issues. And now we've also have the pleasure of administering the new Affordable Care Act program, Personal Responsibility Education, and the absent Title V state mandatory grants. And all those programs promote positive outcomes for children, youth, and families by supporting a wide range of comprehensive services and collaborations at the local, tribal, state, and national level. And so this is just a snapshot, what you're seeing on the screen, of where FYSB, the Family Youth Services Bureau, lies within the Department of Health and Human Services, the Administration on Children and Families, our parent organization, and the Administration on Children, Youth, and Family, which houses FYSB, the Family and Youth Services Bureau, and CB, the Children's Bureau, which is a child welfare aid program. Next slide, please. This is a snapshot of our regions. We don't have regional representation for the federal staff of PrEP, but we do have regional representation from grantees throughout the different 10 regions. Next slide. This is just a slide that shows the different states within each region, and this is also on our website. So if you are, if you're questioning what region you may lie in, what federal region you may lie in, you can check out the website, and it will show you this snapshot. Next slide. We've somewhat gone over the responsibilities and the role that FYSB plays. Next slide, please. This snapshot gives you information about how the funding for the PrEP and the absence programs are divided. You will see that the state PrEP, which is a mandatory block grant, is approximately $55 million, and it authorized funding to up to 59 states and entities. The PrEP Innovative Strategies, as you see, legislatively authorized $10 million. There is also a 5% set-aside for tribes and tribal organizations, and it's approximately 3.2. The tribal set-aside in no way alleviates, states' responsibilities for working with tribal people and organizations in their state under their state block grant program. This tribal funding opportunity announcement has not been issued. Legislation required that we do tribal consultations prior to designing the funding opportunity announcement to get significant input from tribes and tribal organizations, and we have just completed those tribal consultations, and we are now currently putting the full design together and anticipate it being on the streets in the next month or two. Next slide, please. Next slide, please. Okay, I will turn it back over to the program specialist, Labrita White, to continue with the program requirements for the Innovative Strategy grantee.
Okay, this is Labrita White again. And the slide that you have before you speaks to features of Teen Pregnancy Prevention Initiative. And as you know, in reviewing the funding opportunity announcement, there are two funding streams through the funding opportunity announcement for TPP. The Office of Adolescent Health and the Family and Youth Services Bureau both have grantees and programs under this particular opportunity. It's a cooperative effort between the Office of Adolescent Health and FYSB. All of the grantees were awarded cooperative agreements. There's an expectation of fidelity to selected models. Medical accuracy is definitely key to working with the evidence-based intervention programs, and evaluation. We will be providing performance measures information to you at a later date. Independent evaluations are expected of grantees, as well as there will be a federal evaluation of a subset of awarded grantees. Additional program requirements. Grantees are expected to implement and test innovative strategies that target impact on key sexual behavior outcomes, and also to show that the proposed intervention is based on some preliminary evidence of effectiveness, a significant adaptation of an evidence-based program, or a new and innovative approach to teenage pregnancy prevention. The target population, excuse me, youth ages 10 to 19 and pregnant women and mothers under age 21 and their partners. Also, if you review the funding opportunity announcement, it speaks to high-risk, vulnerable, and culturally underrepresented youth populations, including immigrants, Hispanic, African American, or American Indian teenagers, those in foster care or in adjudication systems, males, runaway, and homeless teenagers, out-of-school youth, youth with HIV or AIDS, and youth residing in areas with high birth rates for youth. Priority populations are youth in foster care, homeless youth, teenagers, youth in rural settings, immigrants, school-based populations, racial or ethnic groups, and pregnant and parenting women up to age 21. Teen pregnancy prevention grantees, again, there's a breakout based on the, a twofold breakout based upon the funding opportunity announcement. There were a set of grantees, 75, that were awarded through the Office of Adolescent Health to replicate evidence-based programs. And then under the Research and Demonstration Program, 19 grantees were funded by the Office of Adolescent Health, and 13 grantees, those of you who are participating on today's call, have been funded by the Family and Youth Services Bureau to test innovative approaches to prevent teen pregnancy. This is a snapshot. We won't review it in detail at this time, but just some general information to provide to you as it relates to the teen pregnancy prevention grantees plans for replications. And the information here is primarily based upon those 28 models that are listed on the Office of Adolescent Health's website based on the Kirby study for evidence-based interventions. Here we have a list, and we have 3 slides that address the 13 grantees who were awarded under FYSB. Again, we won't review this in detail. You do have copies of today's slides, and so you can look at it more intently amongst your sites. However, we have each of the 13 grantees listed, as well as the target population based upon your applications that were submitted. We do understand there may be some tweaking that will occur during this phased-in implementation period, as well as the curriculum and our models, evidence-based models that you are proposing to replicate or implement during this grant project period. And so we have Big Brothers of Nevada, Big Brothers Big Sisters of Northern Nevada, Child and Family Resources, Children's Hospital of Los Angeles, Cicatelli Associates, the Moselle to Fime. I don't speak French, a little Spanish, so hopefully I didn't slaughter their name. Education Development Center, Father Flanagan's Boys Home, Lighthouse Outreach, Inc., Ohio Health Research and Innovation Institute, the Oklahoma Institute for Child Advocacy, Philadelphia Health Management Corporation, Teen Outreach Pregnancy Services, and the Village for Families and Children, Inc. So these are our 13 grantees. Again, all grantees were awarded cooperative agreements, and it's a form of a grant. And this type of grant, cooperative agreements, are grants that include substantial programmatic involvement from federal staff. Some examples might include regular communication between the grantee and the assigned project officer, training opportunities, and technical assistance, which you will receive a great deal of in the coming months. Review of materials for medical accuracy, and that review will begin shortly, and we have a slide that will address that. Project officer review of planning period deliverables as well. Just to provide you a reference, you do have access to the grants policy statement, which is a Health and Human Services document that speaks to cooperative grants and other discretionary grants as far as the guidelines as it relates to making those types of awards. And this is just a snapshot of a general description or definition of cooperative agreement. And again, it's an alternative assistance instrument to be used in lieu of a grant whenever substantial federal involvement with the recipient during performance is anticipated. And so, again, with the cooperative agreement, there will be a lot of interaction between FYSB, our contractors, and the grantee. Excuse me. Monitoring cooperative agreements, roles and responsibilities. FYSB has a role as in the form of the project officer, as well as the grants management office. And also, as far as the notice of grant awards, we're responsible for making certain that those official documents are made available, and including any special terms and conditions, as well as contact information. I'm going to ask Griffin Mulcahy if he can help out with some of the slides. As you can probably tell, I'm struggling with the cough here.
Hi, how you doing? This is Griffin Mulcahy. As Bria said earlier, I'm a project specialist in teen pregnancy prevention. We're going to go over the year one expectations for the grants. The grantees are expected to participate in a monthly call with the BRITA for the first 6 months, then bi-monthly for the remainder of the project period. At that time, you're expected to bring up any issues, challenges, or problems, and you can address those in email or phone anytime with the project officer. Participate on the insight visits and annual conferences. Submit all your annual reports on time, and use grant numbers and grantee organization name in all official correspondence. On to the project development. The OAH will help you develop a strong project, which includes a strong planning period. We'll provide technical assistance, site visits, reporting requirements, and again, the annual conference. Your planning period milestones for the grantees to achieve are hiring key staff, complete needs assessment, submit a work plan, submit an implementation plan, submit curricula for medical accuracy review, obtain training for staff in intervention, finalize partnerships with MOUs, describe plan for documenting the intervention, receive approval for evaluation plan, develop and complete a pilot test, and submit a list of proposed adaptations. The planning period deliverables, the grantees must submit the following items to us here at FYSB for review and approval: your implementation plan, your revised work plan, adaptations to programs or other curriculum, any materials for medical accuracy, and an evaluation plan if applicable. FYSB will notify all grantees via letter once approved for full implementation.
And I just want to reiterate here, you should adhere to what's stated in the funding opportunity announcement as it relates to activities that can occur during this phased-in implementation planning period. But full implementation of projects should not begin until you have been notified by FYSB to move forward with, again, full implementation.
As far as technical assistance, your ongoing technical assistance will be provided by the project officers here at FYSB. We will assist with with webinars or net conferences such as today. Additional evaluation technical assistance will be provided throughout the project, as well as e-learning models and individual and group technical assistance. As far as as well as meetings and conferences. As far as the site visits are concerned, periodic site visits will be conducted. The project officer and the grant management specialist may visit the project as needed. There will be a formal agenda for when the project officer will visit. The visit's purpose is to assure that the project is in compliance with the terms and conditions of the authorizing legislation. We'll discuss to assure the project funding not only with the legislation but also with the funding opportunity announcement. And additionally, we'll discuss the project's development and observe how the project is going during implementation, and to provide programmatic financial evaluative guidance and ascertain what additional technical assistance areas are needed. You're expected to submit annual reports. You have to submit a report for a continuation application, which is 90 days. Submit the annual progress reports and financial status report. And then the continuation application is May 31st, 2011. That'll include your Year 2 work plan and budget, as well as guidance and templates will be sent to you before you submit the continuation application.
I'll try to pick up here. Thank you, Griffin. As it relates to medical accuracy, the process for review will involve the following steps. Grantees are to submit the program materials to the FYSB project officer, which is myself. FYSB reviewers will assess the materials, and the grantee will receive a written report once the assessment has been completed. Grantees should submit the materials to the project officer in advance of the pilot test and should discuss timing again with your project officer. We will get to some other information as far as guidance documents a little later, but just to let you know at this point, the submission of documents for medical accuracy, those documents can begin to be submitted to me January 10th. And you have a period of 2 weeks to get those documents in between January 10th and January 21st of 2011. The phase-in implementation period, grantees should be engaging in planning, piloting, and readiness during these first 6 to 12 months of the first budget year. There are some questions about whether or not or what the time frame should actually be. It's dependent upon the progress of each individual grantee. Some grantees may be ready after 6, some 9, some 12. You should continue to assess needs and resources, finalize goals and objectives as it relates to making modifications, updates to your logic model, assess program fitness. Does it fit? What's the program fit for the population that you are have proposed to serve? Build organizational capacity, finalize implementation plans, and again, pilot program implementation. The evaluation and performance measurement information that we're providing, federal evaluation will occur for a subset of those funded grantees for the PREP innovative strategies. Not all grantees will participate in the rigorous federal evaluation. However, on the grantee level, evaluations are expected, and with federal training, technical assistance, and oversight, we will be supporting you in those efforts. Grantees should report on program implementation and outcomes through performance measures. There are 5 broad categories: output measures, fidelity and adaptation, implementation and capacity building, outcome measures, and community data. We will be providing additional information on how you report performance measures closer to the end of this first budget year. So that information will follow. Another slide regarding evaluation, all of the teen pregnancy prevention grantees will have to report out on performance measures, and there's an expectation for fidelity monitoring to ensure that the core components of the model selected are adhered to in implementation. All demonstration projects, as far as the grantee level, evaluation is required, just reiterating that. The evaluation plan must be approved, and we will provide that approval in writing. And 50% of evaluation funds should be restricted prior to approval of your evaluation plan. Okay. The annual grantee conference, 3 staff are required to attend the conference, the project director, evaluator, and 1 additional staff. Expenses for the conference should have been allocated in your budget. The conference will provide an opportunity to network with other projects, face-to-face time with project officers. Grantees will be able to learn about new FYSB as well as Office of Adolescent Health Business, because we do have a federal partnership as we move forward in this project. Learn strategies and information based on evidence-based findings in the field. We do want to make you aware that we now have a date and a venue location for the first conference. It will be held February 7th, 8th, and 9th of 2011 here in D.C. Additional information you'll be receiving additional information in the very near future on how to register for that conference and make your lodging arrangements. Teen pregnancy prevention activities with contractor support. Here you have a list of each of the areas where the Office of Adolescent Health and FYSB will be supporting grantees in this project process. Annual conferences, the contractor is JBS International. General training and technical assistance, again, the contractor is JBS International. For medical accuracy review, the contractor is PalTech. For performance measures, the contractor is the Research Triangle Institute International. For evaluation training and technical assistance, the contractor is Mathematica Policy Research. And we also want to make you aware that additional information and resources are available regarding the project on the FYSB and Office of Adolescent Health websites.
All right, so at this time we're going to take a look at some of the questions that you all typed in, and hopefully address as many as we can before we continue on with the remainder of the presentation. Give me a minute here while we pull up the question box. Okay, the first question is, will there be a face-to-face meeting with all the grantee organizations and ACYF staff in 2011? The answer to that is yes. As Labrita just mentioned, we are planning on having the conference February 7th to 9th here in D.C., and she'll be following up with more information regarding the specifics of that conference. The next question is, what were the yellow numbers besides the EBIs on slide 21?
And the yellow numbers represent the grantees that were awarded the models, the number of grantees who are proposing to utilize those particular models in the implementation of their project.
The next question was asking for a specific topic to be repeated. And unfortunately, we don't have the question.
Griffin, excuse me.
Sorry.
Griffin, excuse me. Labrita, when you just answered that last question about what the numbers are referencing, are you speaking of the 28 models on the website?
Yes, the 28 EBI models on the Office of Adolescent. Thank you for clarifying that. Yes.
And many of the we're referring you to the Office of Adolescent Health website because this is a joint collaboration between OAH and FYSB, but many of these same resources can also be found on our website or links from our website to other websites.
Absolutely.
So the next question was from Doris Spears, and she asked, can you repeat your prior statement? And we don't know what time in the presentation that happened, so if you want to type back in your specific question, that'd be helpful. The next question is, please explain the restriction of 50% of evaluation funds on slide 40.
At this point, your funds have been unrestricted. You can expend the awarded dollars for the grant. However, you should not be moving forward and expending all of your evaluation dollars because your evaluation plan has not been approved at this point in time.
Okay, the next question is, when are project officers being assigned?
Currently, I am your project officer, and Debbie might want to speak to the staffing of the office.
Yes, this is Debbie Powell, and at this time we are in the process of recruitment. We have identified pretty much 80% of our staff, and we're dwindling human resources. We're just waiting for our contract office at the PSC, Park Lawn Sports Center, to move on those hires. They have accepted. They have a great wealth of expertise in teen pregnancy prevention and implementing evidence-based programs. So, and that one of those hires will include the division director for PREP, and the other hire will be also a project officer. So in the meantime, hopefully we get them in by Christmas, but in the meantime, Magrita is acting as the project officer for the 13 Innovative Strategies grants, as well as some of the state grants, and Griffin is her backup for PREP, and he is also the project officer for the Abstinence State Grant Grantees.
All right, the next question is, will the federal evaluation be in addition to the independent evaluation or replace it?
At this time, my understanding is that it's in addition to. All of the grantees are responsible for conducting an independent evaluation of their projects. In addition to, and at this point, we do not know which grantees will be selected for the federal rigorous evaluation.
Okay, the next.
This is Debbie Powell. Let me give you a little further explanation of that. We are in conversation with several of the other programs across the Department of Health and Human Services that also received Affordable Care Act programs that are directly or indirectly related to teen pregnancy prevention. And an evaluation strategy is being developed across the department. So we are actively discussing the best method to get consistent evaluation data. And so we do know at this point it will be a controlled random evaluation. So there may be, you know, at the most probably 15 grantees looked at for the PREP and the Tier 2. And they're also in discussion about the Tier 1 as well. So we will have a better understanding and knowledge about just what that comprehensive department-wide strategy will be. But you do understand that not all the grantees will be evaluated with a federal impact evaluation. So we will get more information out there to you in the next couple of months.
Thank you, Debbie. The next question is, when will we find out the exact reporting required?
You will receive that information in regards, if your question is related to performance measures, that information will be provided closer to the end of the first budget year. So we're hoping late summer to be able to provide that information to you. And I think it states that as well in the funding opportunity announcement.
Okay, the next question.
It did state that at the end of the first year we would come out with specific performance measures, and we are actively looking into that. We have a contract, well, OAH has just awarded a contract to develop performance measures, so we anticipate being on target with getting those specific target performance measures to you by the end of this year.
Thank you.
Okay, the next question asks, will we need to submit our implementation plan if we do not have any expected changes?
If there are no changes or modifications based upon your assessing the fit for your project, as far as the models that you've selected, and moving forward with the phase-in implementation activities, you will not. And also, it would also be contingent upon whether or not the TNCA contractors that we are bringing on board, actually they are on board at this time, and additional information will be shared with you at a later date on when those training and technical assistance services will be available to you. So based upon additional federal review, training and technical assistance support. It could be contingent upon that, as well as to whether or not you will be asked to make any changes regarding your implementation plan. Okay.
Okay, the next question asks, when will the project officer site visits take place with grantees?
We currently don't have a schedule for site visits, and as Debbie stated, we're bringing on additional staff. More than likely, no visits will occur during this first year, but more than likely those visits will begin in the second budget year of your project period.
Okay, the next question asks, can independent level evaluations use evaluation measures provided by federal guidelines if it is appropriate?
If appropriate, yes. And also, we're going to provide training and technical assistance for the to you for your independent evaluation. So we'll be able to, once those that particular contractor begins working with you, we can provide some additional supports around that.
Okay, next question asks, we submitted MOUs in our initial proposal. Will we now need to submit updated MOUs now that we have our cooperative agreement in place?
Yes, we do need updated information as it relates to sub-awards or subcontractors to your grant.
Next question asks, what type of documents, other than curriculum materials, need to be submitted for review for medical accuracy?
We'll cover that momentarily.
Next question is, can we begin drawing down our grants?
Yes, your funding restrictions should have been lifted. However, I want to caution you that drawdowns should only occur for activities that are listed in the phased-in implementation period in the funding opportunity announcement.
The next question asks if we can get a written list of the questions submitted and your answers. And yes, we'll follow up when we post the guidance on the FYSB website with all the questions and answers from today's presentation. At this point, we're going to get back to the webinar, and we will answer any questions you have, again, at the end of the presentation.
Okay, we're going to go ahead and move forward. And bear with us 1 second as we advance the slide.
Okay, I'm going to go over the administrative and requirements, and fiscal requirements for the grantees. First, we'll cover the role of the program office here at FYSB. Our job is to review your applications, plans, and programmatic reports, respond to programmatic and technical aspects of the grants, ensure the amounts to be awarded to grantees are consistent with the statutory requirements, and monitor grantee performance. Specifically, the project officer is responsible for contacting for all programmatic issues associated with the grant, which include review changes in the project scope, review budget revisions, review and approve changes in key staff positions, which requires a letter and copy of replacement staff resume, review continuation applications, conduct and monitor the site visits, which we have touched on, review the progress reports, and review all programmatic requirements discussed. Now the role of the Grants Management Office, they are the official signatory for obligating the federal grant funds and all grant business. They provide the payment information to the Division of Payment Management, so any payment-specific concerns should be addressed to them. Ensure that the applicants comply with all applicable business and non-programmatic statutory and regulatory requirements, as well as monitor all business and financial transactions on grants for the compliance with the federal regulations. In addition, they maintain all official grant files for the individual grant awards. The grant specialist in particular negotiates and issues all mandatory and discretionary grants, oversee the issuance of financial assistance award, notice of award, and the competitive agreement terms and conditions document. They process any budget changes you may have and assure that both the program office and grantees fulfill all requirements of laws, regulations, and policy. Back to Labrita.
Right. And right now we're in the post-award phase with your grants. You've received your notice of awards, and you can move forward again with the phase-in and the planning. Prior approval requirements that are needed during this phase, and this is from this point until the end of the project period. If there's a change of scope, we need that information provided to us for review and approval. Any change in key personnel, change in grantee organization as far as grantee, we've had in the past organization name changes, anything related to major changes with the organization, we need to be made aware of that in advance for consultation, review, and approval of any areas that are necessary. Deviation from terms and conditions of the award, and that's based on the cooperative agreement terms and conditions. Carryover of any unobligated balances from the previous year's awarded amounts. We need for you to submit requests for that. And any significant rebudgeting. Change of scope occurs when the recipient proposes to change the objectives, aims, or purposes identified in the approved application. Key personnel, you're to notify the Grants Management Office in writing. If a principal, project director, or other key personnel specifically named in the notice of grant award will withdraw from the project entirely. Be absent from the project during any continuous period of 3 months or more, or reduce time devoted to the project by 25% or more from the level that was approved at the time of award. Change in grantee organization, I've reviewed that for the most part, but any transfer of legal administrative responsibility for a grant-supported project or program from one legal entity to another before the expiration of the approved project period. Deviation from award in terms of conditions. Prior approval is required in all instances when the grantee deviates from the terms and conditions of the grant, including adding previously disapproved activities or restrictions. As a condition of award, when in doubt, contact the Grants Management Office or your project officer. Carryover policy and procedures. Carryovers, those requests will not be made until you're in your second budget year, and that's based on funds not expended in the current year. I'm not going to spend too much time on that because we will readdress this later on during this year or the early part of next year, but do want to make you aware that that is an option. Significant rebudgeting occurs when under a grant with a federal share exceeding $100,000, cumulative transfers among cost categories for a current budget period exceed 25% of the total approved budget, or $250,000, whichever is less, the 25% or the $250,000. You will need to obtain prior approval before making any adjustments in your budget based upon these terms that we just spoke of. And that approval will be made by your project officer and your grant specialist. Any budget revisions will require a cover letter submitted to the grants office as well as your project officer, the modified SF standard form 424A that speaks to your budget, your federal budget, and in addition to those two documents, the cover letter and the 424A, we will need an itemized budget and your budget narrative that describes how those funds will be utilized. These are the, again, contact persons that you will submit any budget revisions, any grant reports to during the project period, Julia Elam and myself, Labrita White, until you're notified of changes with your project officer for the PREP Innovative Strategies, again, based on the comments that Debbie Powell made earlier about new staff coming on board and the redistribution of some of the grants. Other references, O&B circulars, these are reference documents as it relates to management of your grants. The O&B circulars and federal regulations, Title 45 of the CFR primarily pertains to HHS grants. As it relates to your financial status report, those reports are due annually. However, I did put a note in, this requirement may change to semi-annually in years 2 through 4, but currently the funding opportunity announcement indicates annual reports, which at this time, for the first year, your current budget year, 9/30/2010 through 9/29/2011, your reports will be due in December, which is 90 days after the reporting period. Okay. Please make certain you include your grant award number on all documents that you submit to the grant specialist and your project officer. The performance progress reports are due 30 days after the end of each reporting period within that budget cycle. Again, the funding opportunity announcement references annual reports. However, looking at the succeeding years of 2 through 4, it's a 5-year project period. We may modify that requirement to semi-annual, which would be 2 reportings per year. We definitely want to keep close ties because, again, it's a cooperative agreement. We really need to be consistently informed and updated and substantially involved in your implementation process. As it relates to the payment management system, and that's how you actually draw down funds, I know that some of you are brand new grantees to the federal system, and so we wanted to make available to you information on how to access the payment management system, and that's how you're able to receive disbursements and draw down funds from your grant award. And here we have a web link where you can go for additional information, and also in the guidance materials that I forwarded to you, this information as well as a toll-free phone number is provided if you need assistance in how to draw down funds from your grant. And again, the phone number is here, as well as an email address and web link for the payment management system. And training is available on how to complete those required forms. At this time, we'll pause for questions, see if we have any at this time. Okay, we have 2 new questions.
And okay, again, I just want to remind you, if you have any additional questions, now would be a good time to try to get them into us before we continue. So the first question is, can the revised subcontractor MOUs be in the form of an executed subcontract document?
And the answer is yes.
Okay, the next question is, do any of the other grantees work primarily with health professionals?
We can provide feedback on that when we respond with additional frequently asked questions. That's a great question, and we'll definitely provide a response.
Okay, the next question is asked, for the progress reports, if they are semi-annual, please give the date for the first report. The second one is October 31st. Well, at this point, we're sticking with the annual for now, and we'll follow up with additional information if we decide to go to a twice-a-year format. But for now, just plan on the October 31st, 2011 is your first reporting date.
Right. And if we, just for additional information, if we were to go with the semi-annual, it would cover the period of 9/30 through March 30, and that would be the first 6 months of your budget period, and then that report would be due to us the end of April. Those are all the questions that we have at this time. We'll move back to our presentation.
Griffin Mulcahy again. So we'll try to move quickly through the remainder of the webinar. The last selection of slides is particularly resources for you to be able to utilize on the different government websites. This particular is about the OMB website, which is a good resource for, as well as the federal regulations that are covered under your grants. The Division of Payment Management, which we discussed earlier. If you have any trouble drawing down your funds, that would be where to go. And then the final link is for forms from the ACF website for documents you submit to us. The next slide. Next slide is just a series of links to different pregnancy prevention resources that we've provided. Again, all very helpful resources. And we encourage all grantees to check out various resources when developing your plan.
Let me just draw your attention to a couple of significant ones listed here. Of course, the Family Youth Services Bureau website and some of the information, the guidance information, guidance documents will be posted there, as well as other resource information. We have some resource information already posted, so that's a great link to begin to navigate. Another is the Office of Adolescent Health. If you need more information on those 28 EBIs, evidence-based interventions that were reviewed via OAH in the Kirby study, as well as want to bring your attention to the final listing, findyouthInfo.gov, which offers a plethora, just a broad range of youth programs and services based, and it's actually, you can locate by state and find out what programs have been federally funded in your state that you may want to partner with.
Okay, and as Labrita had just mentioned, the webinar, the PowerPoint, as well as additional guidance documents will be provided on the FYSB website. And when they do post next week, expect a follow-up email from Labrita letting you know when those resources come available.
Okay. And because of the holidays, we were hoping to have the information posted for you. That's okay. We're hoping to have the information posted for you by next week, but the Thanksgiving holidays are fastly approaching us, and so we do anticipate having everything available, updated by November 29th, by close of business on Monday, November 29th. Here we have, again, the FYSB Internet. We've provided for you a screenshot. If you go to our Internet site, this is the home page, and highlighted with the red ovals are areas that we thought you might want to be aware of as you work with the PREP Innovative Strategies project. The information from today's webinar, you will be able to find that all the way to the right where you see Secretary Sebelius, this just in that section. To the left, grant awards, if you click onto that particular link, you will see all of the awardees for all of the teen pregnancy prevention programs, as well as the other FYSB programs. Locate grantees. Once you click onto that, you will see a map of the United States, and you'll see other grantees that have been awarded funding through FYSB. And the teen pregnancy prevention link will take you to a list of all of the awardees. There's a directory that's available to you to know who the other awardees are if you want to reach out and connect with them and network, as well as some other resources that you can utilize as you move forward in this planning phase. Again, the map is here that we spoke of, where you can locate other grantees by clicking onto the state. And here in the bottom left quadrant of the square that we have here, you'll find information specific to Innovative Strategies programs. And to the right quadrant where you see the pink arrow, general information and resources. The Teen Pregnancy Prevention Resources is a significant list of web-searched organizations and websites that provide information related to teen pregnancy prevention. And again, you can also go to and click on to Located Teen Pregnancy Prevention Program and find other programs. Here we have guidance documents. You did receive a copy of these documents just prior to today's webinar. And again, today is not an all-in-all session for us to be able to communicate, just to provide an overview. So if there are questions or concerns, we can speak to those in other conference calls. But the budget document speaks to how the budget should be structured when you submit it for budget revisions, as well as when you submit your continuation application for continuing the project for the next budget year. Here we have the grantee reporting timeline that speaks to when information is due to FYSB, to your project officer, as well as due to the grants management office to your grant specialist, and how to submit that information. Here we have some questions and answers that were provided today. We will be providing additional FAQs and making updates based on questions that were asked during today's webinar and other questions that may filter in the next day or two. And so we'll update the frequently asked questions, and when we make the posting on November 29th, we should have additional questions and answers to attach here. We reference a directory for grantees, and that's available on the FYSB site, and this is a sample of what that looks like. And again, the resources that are available that you, based on a website review, that information again is available to you through the FYSB website, and this is just a snapshot. It provides a table of contents and then some topical areas that you can search for if you have specific questions and want to research further. Okay, and we've covered the resource documents and this just in heading where you can locate information from today's webinar. Just want to remind you that when you're submitting documents, again, make certain that you include the name of your grantee organization as well as your grant number.
So again, at this time, we'll open it up for any questions and review any questions that were posted over that last section.
And I think we have some questions here under chat. If we can take a moment to look at those. Bear with us 1 second. Okay. And we have one question here.
Okay, we have first question is there a percentage in how you are defining significant budget changes?
Okay, there's a slide that references what's significant. It's 25%. If you're making a change in rebudgeting among categories, if there's a 25% change based on your total budget, or $250,000, whichever is less. And there, again, there is a slide that addresses that. And we're going to check our questions box to see if there are additional questions. And there appears to be a few. Maybe not. I think we've responded to all questions based on those that have been typed in and submitted to us via chat or the questions section for GoToWebinar. At this time, Debbie, do you have any additional remarks?
No, I don't. I just hope and encourage you to go to the website. We have also been in conversation with the Office of Adolescent Health, and you will be included on any conference calls or webinars that they have as well. They also had an orientation webinar, and we have used many of the slides, or at least coordinate the information provided to their grantees and also with you. But we're trying to coordinate and collaborate with the Office of Adolescent Health as much as possible to have you a part of discussions about the program and the process, even if it's not applicable totally to what you're doing. We think that you should have the opportunity to hear the dialogue that is being provided and presented.
All right, we did have some additional questions come in, so we'll address those while we can. The first one is, what type of documents, other than curriculum materials, need to be submitted for the review for medical accuracy?
Okay. Any videos, pamphlets, any materials that will be distributed and utilized with your targeted population for the purposes of preventing teen pregnancy.
Okay, the next question is, what is the difference between a project work plan and implementation plan?
There's just well, actually there really isn't a difference. It's your implementation plan or work plan, which pretty much speaks to what are your tasks, your responsible persons, your target dates, and the activities in order to successfully implement your project.
Okay, the next question is, what is the time frame for the approval of those plans, of the implementation plan?
At this time, I don't have that data available, but I will certainly make certain that we provide this question and the appropriate response in the FAQ.
And we'll also make sure that we coordinate our answer about the work plan and the implementation plan with the Office of Adolescent Health, because we want to make sure that we're giving you the same information they're providing to their 19. So we will coordinate that answer, and it will be on the frequently asked questions posted on Monday the 29th.
And I assume that would apply to the evaluation for approval of the evaluation plan as well?
Right, right. Because all of the contractors are brand new on board as far as kind of actually getting acclimated to what our needs are as they move forward with providing support for you. And so we don't have all of those timelines concretized at this time, but we are working on that and should, in the very near future, be able to actually provide you a specific calendar that speaks to everything that's due to us, what those due dates, as well as what the review period will be, when you will receive final approval notification. So if you can bear with us just for a little, we are definitely working expeditiously to coordinate those efforts and to keep you informed and abreast.
All right, looks like it's it for the questions. We want to thank everyone again for joining us, and we'll be following up shortly with additional information and let you know when all the material from today's presentation becomes available on the FYSB website.
Thank you very much, and we look forward to working with you. Have a great day.